Welcome to the first video in the series, Management of Patients with Chronic Conditions, Medicare's Coverage of Diabetes Care Within the Wellness Visit. This presentation is designed to support healthcare workers in understanding the national government services role, as well as offer some education and self-service resources. This series was originally hosted by Superior Health Quality Alliance and presented by National Government Services in January 2023. During the presentation, you will learn to understand the National Government Services role as CMS Medicare Administrative Contractor, or MAC, and the different types of MACs, as well as increase your knowledge of the events, education, and resources available to providers.
And on this slide that you're seeing before you, it's our disclaimer that says basically we are a contractor of the federal government, and we get our information from CMS, which is the Centers for Medicare and Medicaid Services. And we rely also on Congress and Health and Human Services to determine law and regulations. And as a Medicare administrative contractor, which Kathy will go in more, we implement those laws and regulations as such.
By now, I'm sure that you have heard the term Medicare Administrative Contractors, or MACs. MACs are made up of private insurance companies under contract with CMS to administer each part of the Medicare program. As the current J6 and JK MAC, NGS is categorized as a fee-for-service operation. A fee-for-service MAC processes claims and handles all Medicare operations for those providers in specific MAC jurisdictions. NGS processes claims for Part A and B, as well as claims for home health and hospice providers via our home health and hospice contract. Contractors are bound by specific service areas that are defined by CMS. J6 MAC jurisdiction states include Illinois, Minnesota, and Wisconsin, and a few in Michigan. JK MAC jurisdiction states include Connecticut, Maine, Massachusetts, New Hampshire, New York, Rhode Island, and Vermont. In addition, within the J6 and JK contracts, we also serve as the MAC for FQHC and home health and hospice providers in a large number of states. Now that you know a little bit more about the Medicare contractors, this slide has a helpful tool to help you locate a contractor when you have a question or some other reason that you may need to contact one. The Review Contractor Directory interactive map shown on this slide will help you to navigate to all of the various MACs and contractors who are responsible for services in each state. Simply go to the CMS website listed on this slide, click on any of the states, and the contractors and their contact information will be displayed for you. Next slide, please. Again, National Government Services is a traditional fee-for-service MAC. NGS has, again, several different types of contracts and processes claims for Part A and B, FQHCs, and home health and hospice providers for all the states that I just mentioned in J6 and JK. NGS serves 240 members of Congress. NGS also allows Medicare providers to have millions of interactions to answer their educational and billing needs through self-service tools, including the NGS website and NGS Connects, which we will discuss here in a little bit. Now, I wanted to take some time and go over some resources that are available to the provider community. Next slide, please. This is the NGS Medicare Combined landing page here on this slide. On the left side, you can access ngsmedicare.com provider content website. This is where you can register for educational events, view Medicare news, find coding and billing information, among other things. If you want to log into NGS Connects to perform secure transactions or inquiries, you will enter your login credentials in the applicable fields on the right side of the page. Please keep in mind you do not need to enter information in both sides to access NGS Connects. If you are not yet registered for NGS Connects, you can do that by selecting the Create Account link under the login fields. If you are registered and you're having issues with your login or you need to reset or change your password, you can select the Can't Login link. You can also find additional resources for NGS Connects by selecting helpful links there at the bottom of the screen. Next slide, please. This slide is displaying the home screen of ngsmedicare.com. For easier navigation, the most frequently viewed areas of the website are listed here on the home page. The medical policies tile will provide easy access to NGS's medical policies or local coverage determinations. The enrollment tile will provide information regarding the provider enrollment process. The next tile, Fee Schedules and Pricers, provides detailed prospective payment systems or PPS and pricers information for ESRD, FQHC, inpatient entities and skilled nursing facilities, and more. The Claims and Appeals tile provides information on Medicare beneficiary identifiers, Medicare secondary payer, NGS Connects, and top claim errors, as well as levels of appeal and time limits for filing and reopening instructions. If you need to know how to respond to an overpayment request, the overpayments tile is where you can start. And last but not least, the Medicare compliance tile will provide you with information on comprehensive error rate testing, fraud and abuse, medical review, prior authorization, recovery audit, supplemental medical review contractor, and targeted probe and educate. Next slide, please. As you can see, navigating the NGS Medicare website is easier than ever. There is a wealth of information available to the provider community within a few clicks. Here on this slide, I'm showing you the education tab of the website. This is another avenue for providers to access a wide array of information. The Medicare Topics tile allows providers to access detailed information regarding appropriate use criteria, beneficiary notice initiatives, billing, clinical trials, coding and edits, COVID-19, documentation, home infusion therapy, modifiers, pain management, tobacco cessation, and much more. You can also select a specialty to learn more about in the specialties tile. This encompasses ambulance, laboratory pathology, opioid treatment, skilled nursing facilities, and more. Are you looking for Medicare Learning Network or MLN articles or informative articles from NGS? These can be located under the news tile on our website. And lastly, the manuals and guides tile gives providers access to the EDI e-signature user guide, the FIS DDE provider online guide, the fundamentals of Medicare, Medicare diabetes prevention program, telehealth services, and a targeted probe and educate manual. Lots of information out there for the provider community. Next slide, please. Here on this slide, I wanted to show you the education events tab that's on our website. You can scroll through the current events listed to find education events that you may be interested in attending. Please note, if you are unfamiliar with the website, the education that is listed in blue, those are active upcoming events. You can simply click on the registration option of the event that you're interested in and follow the prompts to register. I'm not showing it here on the slide, but if you scroll down further, you will see education events that are gray. These events have already been completed. However, you can click the read more option of the event and obtain that presentation from that event if you like. You can also utilize the search engine located in the middle area of the page to look for specific types of education. We always welcome provider feedback on the events that we do. There is a share your education thoughts with us survey at the top of the events page. You can share your education experience as well as offer suggestions for future education topics with us. NGS is always striving to meet the needs of the provider community. We offer a wide array of educational webinars. We do in-person education, and we collaborate with a multitude of agencies and entities to assist and educate the provider community.
Thank you for listening to this session. We hope you'll join us for the other 3 videos in this series: Medicare's annual wellness visit, diabetes self-management training, and medical nutrition therapy.